just really plainly, what is MCT oil? What does MCT stand for? So MCT is medium chain triglyceride, and we'll unpackage that in the next 10-15 minutes here and go through all the terminology, because again, when I grew up and going into just learning about nutrition back in high school, I was always taught that saturated fat was in general not healthy and it led to plaque buildup and so forth. So hopefully, again, by the end of tonight, you won't have that thought anymore. So it'll be replaced by hopefully solid new information here. So MCT oil is a saturated fat. We'll distinguish saturated versus unsaturated. Some of them are healthy, some of them are not. There's that handout that I gave tonight, we'll kind of go through some of that too. So how is a saturated fat supposed to be healthy and actually reduce cardiovascular risk, improve mental function, so forth, when I thought that was going to clog my arteries and reduce blood flow and so on and so forth. So I'll kind of unpackage all of that. So one thing that I was preparing for this weekend was this talk, and my 10-year-old is a swimmer at Schrader, and I bought some pistachios for her and I to snack on. And you can't read it up here, but it talks about pistachios, nuts being heart healthy. And then I blew that up, well, it's even hard to read the fine print. But what the manufacturer of these pistachios essentially package these nuts, the government allows them to put this statement on there. It says, scientific evidence suggests, but does not prove, that eating 1.5 ounces per day of most nuts as part of a diet, again, here's the key point that we'll get at low in saturated fat and cholesterol may reduce the risk of heart disease. And then it says, see nutrition information for fat content. And so even with this statement, I'm led to believe that if I get too much saturated fat, that's a problem. So it's even on packaging. It's every day. We see it all over the place. I was kind of surprised when I saw that on my pistachios. So why the bad reputation on saturated fat? And MCT oil is supposed to be really good for us, and that's a saturated fat. It's like, how can it be both? So simple reasons. There's a lot of greed involved with this, a lot of politics involved with fats, and a lot of just misunderstanding. So combine all that together, you get the perfect storm. Not to give a ton of history, but Dr. Bruce Fife has written a fantastic book called Coconut Miracle, or Miracle of Coconut Oil. He goes through a lot of history of saturated fats and why they've gotten a bad rap. But long story short, back in the 80s, a lot of the vegetable oil industries basically came out and lobbied the government and so on and so forth. And here's this one excerpt here that the American Soy Association took saturated fats and basically said that they were just toxic to our health. And so that just kind of spread, and then all saturated fats are not good for us anymore. What happened is then with the corn oil and soybean industry, that industry increased dramatically, and that resulted in the use of all these hydrogenated oils, which we'll get into is not good for our health. When you hydrogenate an oil, it preserves the food, keeps it shelf stable. The food doesn't go rancid on the shelf, but for our health, it just isn't good. When we get into trans fats, which I think is on that handout, trans fats really, for all practical purposes, trans fats are just synthetically made. Fats that are found in nature, when you get into the chemistry of them, we'll get into in just a minute, you really don't find trans fats. And so our body really doesn't know how to process those fats. They're synthetically made essentially, and they're going to build up in our body and cause a lot of health concerns. So there's study after study that very clearly indicates, so I put coconut oil. Coconut oil is a medium chain triglyceride. It's an MCT oil essentially. We'll talk more about that. Part of a normal diet has no effect on cholesterol whatsoever. If you play the macronutrient game correctly, like if you do a ketogenic diet, my argument always is that if you increase the amount of MCT or coconut oil, or basically healthy saturated fats to your diet, you could dramatically reduce your cholesterol levels. My cholesterol level before I went on a ketogenic diet ran way above the 200s. I did have a lot of HDL, a lot of good cholesterol, but overall my cholesterol level was still very elevated. Once I switched over to a high-fat diet, my cholesterol dropped dramatically. So we'll go through that as well too. There's epidemiological studies over and over again that has shown populations that consume large amounts of MCT oil or coconut oil, they have almost no heart disease in these populations that are just eating 60% naturally of their diet of saturated fats, basically of tropical oils. So how can that be? And then in our country, we deem them as just something that we need to stay away from. Okay, so I'm going to go with that. So understanding the chemistry of fats. So there's really, in my mind, there's two buckets, and then we'll break those down even further, but there's saturated fats and unsaturated. When you look at the chemistry, and actually, did I grab a handout? I think I did. Let's just kind of walk through this at this point, but you've got, on one side of this chart, it says medium chain fatty acids. And then on the other side, you got long chain fatty acids. So there are three different lengths of fats that we just arbitrarily categorize them essentially. There's short chain, medium chain, and long chain fatty acids. But within those three categories, within those buckets, there's actually two separate buckets. You can have it saturated or unsaturated. If it's an unsaturated fat, that fat is really more unstable. That's the way I think of it. There's what's called a double bond in the chemistry of it between two carbon atoms. Long story short, like a fish oil is an omega-3 fatty acid. What does that mean? Is that there's different bonding of the fat that makes it more unstable. So anytime I see an unsaturated fat, I think of a stability issue. What that means is that fat can go rancid, it can oxidize, and that in turn would have a potential negative consequence to our health. The issue though is with omega-3 fatty acids, I'm a huge promoter of omega-3 fatty acids. So when you look at these fats, it can be very hard to distinguish just based on its chemistry, whatever bucket it belongs in, if it's good or bad for us in general. So like with an omega-3 fatty acid, which is unsaturated, it in turn actually has an anti-inflammatory effect. However, though, you have some other unsaturated fats, vegetable oils and so forth, that are on this list. They're also unsaturated, but they actually increase inflammation. So how can that be? It really has to do with the chemistry, where these bonds are at, and how they fit into our cells, essentially. So it's kind of hard to kind of navigate all of that, but just know that there's kind of two different camps. There's saturated, very stable fats, and there's unstable fats, which are unsaturated. So, and then there's different lengths of them. We'll get into that a little bit more too. I'm going to refer to lipids as fats or as oils. Fats that are that should be the word solid at room temperature. Oils are going to be mainly liquid at room temperature. Coconut oil is very unique. So medium, like an MCT oil, medium chain triglyceride oil. Most of them that I have here as example are going to be a liquid. But coconut oil, it too again is a medium chain triglyceride. It's a solid at up to about 76 degrees or 74 degrees. Once it hits that point, then it will turn into a liquid. We'll talk a little bit more about that. Most abundant types of fats come in the form of something called a triglyceride. I don't know if I included that in your handout, but I have a picture on the next slide. Something to keep in mind when we consume fats, again, whether it's saturated or not, it comes in I call it packs of 3. That's a triglyceride. And you see that on when you go to the doctor and you get your cholesterol test back, you've got your good and bad cholesterol, your HDL and LDL, and then you got something else called your triglycerides. And that's just how much fat essentially is floating around in your blood. So when we start consuming coconut oil or MCT oil, that number can go up. So when I started a ketogenic diet, my triglyceride number went up substantially. It was at around 150. It jumped up to 240. So you'd think that'd be alarming, But then you got to realize what you're doing. You're consuming more of these triglycerides. Naturally, that number is going to go up. It'd be surprising if it didn't go up. So, touched on this already. So there, again, I always think of two categories: saturated, unsaturated, and then on top of that, or within that, you've got three other little buckets: saturated, monounsaturated, polyunsaturated. If a fat only has one double bond in its length of carbons, that's just called monounsaturated. Going back to fish oils, if you have an oil that has multiple double bonds, which is less stable, then you've got 2, 3, potentially 4 double bonds in that oil. And that's why I refrigerate all of our fish oils. They're unstable. Again, it's a polyunsaturated fat, but anytime there's heat or light introduced to a polyunsaturated fat, it has a potential to oxidize. Once it oxidizes, it's again going to have a negative consequence on our health. So again, if I'm taking fish oil, or I recommend somebody taking fish oil, once they purchase it, I'm always going to have them, when they get that back home, to keep it refrigerated. A key point here: so health benefits or risks are independent on the degree of saturation of the fatty acid. So you can have a coconut oil, which is a saturated fat, have a positive influence on our health. You can have something like a fish oil that's polyunsaturated and be just as healthy for us overall. Different properties, but you got to look at each individual oil, each individual fat, to see if it's going to have a net benefit or risk to our health. Another example I put on here is olive oil, predominantly a monounsaturated fat. But again, we know the Mediterranean diet, that overall, as long as it doesn't go rancid and is oxidized before we consume it, has a net positive effect on our health. This uric acid, fatty acid, same category as olive oil, but has a very toxic effect to our health. So we've got to be careful. We've got to look at, actually, when you look at the fat content of a food product, we really need to know what those individual fats are, just outside of just is it saturated or unsaturated.
So Dan, what would that be in the food that we would be eating? Possibly?
Potentially, yep. We'd have to look at the supplement facts, the nutritional facts, to see if it's actually in there or not. So saturation and size of fatty acids. So saturated fatty acids, there are basically, if you think of a long chain, there is hydrogen atoms throughout this whole entire carbon chain. When I think of it just structurally, it's a very solid structure. It doesn't have the ability to be oxidized or damaged and then in turn have a negative consequence on my health. Saturated fatty acids, again, do not have any double bonds. If I ever see a double bond in a chemical structure, there's an opportunity there for that product to be broken down, oxidized, and have a negative consequence on my system, essentially. So, the more double bonds, the weaker the carbon chain, which greatly influences the health outcome. Again, it's either good or bad. So if I have a fish oil that it's an omega-3 fatty acid, it's polyunsaturated, it has actually 3 double bonds in the chain, there's a lot of opportunity for a fish oil to go rancid real fast. And that, in turn, you think, oh, I'm taking something that's healthy for my overall health, my cardiovascular health, when in turn, those double bonds essentially could have already been damaged. They could be oxidized, broken up already, and then that fish oil that you think that you're taking is going to have a positive outcome on your health could be ruined already before you get it. So if it's rancid and it smells bad, definitely do not take it. So
is that your only indicator, the smell of it?
The smell potentially. Well, that's a great question. So the issue with vegetable oils that are polyunsaturated, when they go rancid, they don't have a smell. That's a huge problem. There's other than like chemical testing, that like if you go and grab some vegetable oil off the shelf at the grocery store, it might have been sitting there for you don't know how long potentially. It could be rancid. You could use it and you have no idea that it's rancid. That's a huge problem. Yeah.
What about the fish oil capsules?
The fish oil capsules are fine up into a point. My argument is even if you keep fish oil capsules, and obviously they're encapsulated, their oxygen's not getting to them through the air essentially. There's some vitamin E typically in fish oil capsules to act as an antioxidant. If air, there's at some point oxygen is going to leach through that gel cap and get to the oil, but then you have vitamin E there to kind of sequester that oxygen. I still would recommend refrigerating the capsules. Yeah.
Before the bottle's opened?
Best case scenario, I would. If I didn't have that opportunity, it'd be okay to keep it at room temperature. But once it's opened, obviously then oxygen's getting in that bottle. Yep. Yep. There's a couple of different, when you look at, so again, medium chain triglycerides are typically about 6 to 12 carbons long. We'll get more into that. There's some short chain fatty acids. Acetic acid, which is found in vinegar, we all know that. That's only 2 carbons long. Butyric acid, butyric acid found in butter only is a 4 carbon chain, and we'll kind of get into that. Meat and fish, animal products are 14 carbons essentially. Beef fat is 18 carbons. So the longer this chain is, I always think of it this way too, the more of these carbon atoms that are stacked up and forming this chain, our body has to process that and break that down 1 carbon at a time essentially to break that down to use it as fuel. And so the longer it is, the more process. I think, and I'm oversimplifying this of course, but in general, the longer that chain is, the more energy my body takes to break that down to use it as fuel. I just mentioned this, I get ahead of my slides a lot, you probably know that already, but long chain fatty acids, 14 to 24, medium chains 6 to 12, short chain fatty acids are less than 6. When you combine 3 of these chains together, we call it the triglyceride, which we see that in our lipid test. And so again, the longer that chain is, the more I've got to break it down. And that's irregardless. Again, these 3 categories here, you could have them be saturated or not. So the fish oil that's on here, on this chart, is polyunsaturated. It's a long carbon chain. It's all the way to the right-hand side. EPA, for example, fish oil is a 20 carbon chain, where DHA, again, both the great anti-inflammatory effects for both of those fish oils, that the DHA is 22 carbons long. Again, but that because of those 3 double bonds in the fish oil, I want to preserve those. I want to keep them protected from light. I want to keep them cold so that they have that ability to provide still a health benefit when I consume them. So that's important to realize that. So both the degree of saturation, the length of the carbon chain determines the fatty acid chemical properties and their effects on our health. So you have to look at each individual fat and again realize, is it a saturated fat, is it unsaturated, and then where are those double bonds in those unsaturated fats, and that's going to dictate what the health outcome is in that particular oil. So you can have 2 oils, 2 fats that are essentially in the same category, and depending on where those double bonds lie, could have completely different health outcomes. And so that's where there's a lot of confusion. Not all fats are created equal. So if you go back to, let me go back to my last slide here, this one here. If you're consuming a lot of animal products that are high in saturated fat and they're very long carbon chains, 14 or greater, that potentially could end up, increasing our cholesterol, increasing just the fat that we wear on our skeleton, right? Can add to body fat, essentially. But then you look at something that's coconut oil, which is also a saturated fat, but it only has 6, 8, 10 carbons long. That's going to be processed completely differently. Yeah.
What about the grass-fed beef? They claim that has a better or more healthy fat. Is there some difference?
There is, yeah. There's a completely, that's a great point. There's a completely different fat profile in beef that is grass-fed versus grain-fed, absolutely. Even with fish, for example, you always want to go with wild-caught fish that's going to have more omega-3 fatty acid content than a fish that is just basically farm raised and grain fed, essentially. That's a great point. So the more saturated and longer the fatty acid chain is, the harder for that fat. The harder the fat, so it's more of a solid essentially, and the higher the melting point. When I think of it that way as well too, is the longer that chain is, and the more saturated that chain is, so there's no double bonds, the harder it is for my body to break that down. So lard, long chain fatty acid, it's saturated, is a solid at room temperature. Whereas with corn oil, we all know this, vegetable oil, also a long chain, but this is polyunsaturated fat, is a liquid at room temperature. Now it is easier for me to break that down metabolically, but there's consequences to that as well. So we'll talk about that. Then you throw avocado oil into the mix. Again, generally thought of as a healthy fat. It's 70% monounsaturated. It's a liquid at room temperature. You start to cool that down, it becomes almost like a semi-solid. You could do this at home and see that it actually turns really cloudy essentially in the refrigerator. But it takes time to break down avocado oil, more so than, again, a medium chain triglyceride, a medium chain fat. I threw this picture up here. I didn't throw this out as a handout, but when I was going through all the research on fats, there's just so much misinformation out there. I can't remember exactly where I pulled this off of, but it talks about the different categories of the fats: saturated fats coming from animal products, monounsaturated fats having the double bonds. But even some of the information that's listed on some of these handouts is inaccurate, talking about raising HDL and lowering LDL, talking about how tropical oils are going to raise cholesterol, which again, it's not going to do that. So you got to be careful on who's giving that information out. Fats found in our body, so we know when we're born, we've got white fat and brown fat. As we age, and white fat is essentially the fat that we wear, is the way I call it, where brown fat is more metabolically active. We want more brown fat on our body, and we can actually increase that by consuming more MCT oil, more coconut oil. The triglyceride forms, not that this is terribly important, there's stearic fatty acid, palmitic, and oleic fatty acid. That's typically the fats that are found on our tissues, inner tissues. So here's the paradigm shift. So coconut oil is about 64% medium chain triglycerides, medium chain fatty acids. And there's palm and palm kernel oil. They are really the best sources for MCT oil. So I've got pure MCT oil. I'll talk about that in just a minute. But when you really look at if I want to use an oil to my advantage for health benefit, I'm really going to go after coconut oil because it is the most cost-effective source for medium chain triglycerides. So that's going to provide easy energy. Doesn't take much to metabolize coconut oil, and it's not going to be stored as fat on our body. It's going to be burnt up as fuel. I'll talk about that too in just a minute. So medium chain, again, triglycerides or fatty acids, and short chain fatty acids. These give unique health promoting properties. Nobody really talks about, again, short chain fatty acids, medium chain fatty acids. We just get the information that saturated fat is bad. But when you look at coconut oil being a saturated fat, being a medium chain triglyceride, it has all the health benefits that we're going to get into right now. So we've got to just kind of keep that in mind. Saturated fat nor cholesterol cause heart disease. So hopefully that's not new information. There is study after study now that is showing that half of the heart attacks in America are in patients that have normal cholesterol levels. And so it's not an issue of cholesterol anymore, it's an issue of inflammation. So real risk factors, associated with heart disease. I listed about a half a dozen of them here, but high blood pressure, age, gender, so being male, higher risk. We won't get into that tonight. Tobacco use, diabetes, obesity, stress, lack of exercise. Here's my big thing, elevated insulin levels. When I went to pharmacy school, we were all taught to, when we were going through diabetic training, of tracking patients' blood glucose levels and their hemoglobin A1C. What we really should have been taught as well, not that those are important, but really tracking a patient's insulin level. If I know what your insulin level is, that will tell me so much more about your health than really just a one-time blood stick to find out what your glucose is in that one particular moment in time. Because if I know that you're cranking out more insulin than you should be, that is leading to downstream a whole list of inflammation that we don't want in our system. So if next time you go to the doctor, you might have to fight him or her on it, but ask them to draw an insulin level on you, not a blood glucose level, because that's going to really, and then bring that back to me and I'll tell you if it's good or bad. But you want that insulin level in your body to be low. And homocysteine, elevated homocysteine levels will strongly correlate with heart disease. The fat that collects in arterial plaques, so if you actually start taking apart the plaques that you find in patients with the clogged arteries, the majority of that fat is actually unsaturated fat. Corn oil, soybean oil, vegetable oils. It's not your coconut oils. It's not your saturated fat from your butter, your cheese, that kind of thing. This is what we talked about earlier about the rancid oils. So vegetable oils easily oxidize due to overprocessing and overheating. And once those become rancid and oxidized, you have no way of telling if that happened to it or not, which is scary. I'm going to skip that. That's just another depiction of the categories of the different lengths of carbon atoms that you guys have. Skip that. So new approaches to heart disease prevention. So coconut oil does not have a negative effect on cholesterol or triglycerides. So you can eat as much coconut oil as you want, and it is not going to change your cholesterol level whatsoever. Like I said, I would argue if you get into a ketogenic diet, it'll actually improve your cholesterol numbers. Coconut oil, or again MCT oil, I'm kind of using those two terms back and forth interchangeably, do not promote platelet clotting. That's another thing, is when the soybean industry came out in the 80s, there was this whole issue that there was a whole clotting issue going on as well too. But again, studies have proven over and over again, coconut oil or MCT oil doesn't increase bleeding whatsoever. Coconut oil protects the heart arteries from injury caused by bacteria, viruses, and free radicals. There's this association with cardiovascular disease and infection. And so I'll get to that in a minute as well too. But when coconut oil gets broken down and processed in the body, it has a profound effect on our immune system and helping our immune system fight infections. And that in turn can actually lower our risk of heart disease dramatically, just by its antiviral, antibacterial properties. So a little bit more on this antimicrobial agent. So when you get into coconut oil and you ingest that, you ingest it as a triglyceride format, and your body starts breaking that down into what they call free fatty acids. When that process starts happening, you actually get those free fatty acids that are basically integrating into viruses, parasites, bacteria, and breaking down those organisms and basically destroying them, just splitting them apart, essentially, is the way I describe it. Again, labs have shown this over and over again now. Medium chain triglycerides, fatty acids, coconut oil, when that is metabolized and broken down into its free fatty acid form, it has antibacterial properties, antiviral properties. It helps with fighting fungus and yeast, even parasites. So the key point here, medium chain triglycerides, MCT oil, that is within coconut oil, needs to be transformed in the body to its unique fatty acid form. So you can't just put coconut oil on let's say you have an infection on your skin, on a wound that you want to try to heal. You can't just put the coconut oil right on that wound and allow that to be your antibiotic. You actually have to consume the coconut oil to break it down into a fatty acid, a free fatty acid, for that effect, that antimicrobial effect to take place. So be aware of that component there. It needs to be ingested and broken down to a point. This is just some of the breakdown of these carbon chains: caprylic acid, capric acid, myristic acid, lauric acid. The one thing I'll point out here on this slide, when researchers are looking at fatty acids and free fatty acids from MCT oil and coconut oil, the problem, like even with this MCT oil here, it doesn't have lauric acid in there. So if you are trying to take an MCT oil or a coconut oil to help as an antibiotic or antiviral product, you actually can't take the MCT oil. You need to take a coconut oil. That's where the lauric acid is not found in pure MCT oil. Be aware of that. You get great antifungal properties with caprylic and capric acid. So if you take MCT oil and you're trying to fight a yeast infection or candida, that'll work for that. But if you're trying to fight a virus off or just a general bacterial infection, then you'd have to switch to coconut oil.
So what's the difference between the two? You're comparing the coconut oil to the MCT oil.
Yeah.
It's seeming the way you're talking that the coconut oil is better than the MCT.
Yeah.
So what's the purpose of it?
Of the MCT? Less processing by the body, so you are going to get that quicker energy boost
Than coconut oil?
than a coconut. Yep. Coconut oil needs a bit more processing to happen in the body, and it takes time, and so that's really the differentiator there.
Okay.
Overall, if I had to choose, I would always choose coconut oil over just pure MCT oil. MCT oil, by definition, is just a processed format of coconut oil. Yeah.
Because you were saying, don't you take MCT oil?
I do, but I also take coconut oil. So it depends on the application that I'm going for. If I'm going for a quick energy or like the mental clarity component, I'll go MCT oil. But overall health, I'm going to go coconut oil.
But don't you just you have to take it consistently, don't
You
you?
do. Oh, for sure. Right. Every day I'm consuming both.
Yeah.
Yeah, for sure. Mm-hmm.
Okay, thank you.
Yep. This is just a breakdown of coconut oil. So here's your lauric acid and so forth, the caprylic and capric acid. So when you get into just pure MCT oil, like this guy right here, it's strictly just capric and caprylic acid. So I'm losing, and actually myristic acid is not terribly important in what we're talking about tonight, but this lauric acid really has got that antibacterial property to it. So that's why I would go with coconut oil. Because MCT oil in coconut oil needs to be processed. We just said that. So again, you can get some this monolaurin, monocaprin that's going to break down from MCT oil and have some effect, but really it's the coconut oil that you want. So here's where you kind of get into that ketogenic discussion of, how I'm promoting eating a lot of saturated fat. We're talking 60 to 100 grams of saturated fat a day, essentially. That's, times that by 9, that's a lot of calories. And so, but some of the thing is that we all typically know this by now, that we're losing the battle on obesity. Estimates are now approaching 40% of the U.S. population is considered obese. It says all fats, saturated or unsaturated, it says from a cow or corn, contain the same number of calories. I put a little asterisk there. So when you look at the whole bucket of fats, so you have fats, proteins, and carbs. Carbs, for every 1 gram of a carbohydrate, you get 4 calories. Protein, for every 1 gram of protein, you get 4 calories. If we're counting calories here, then that's where fat also gets another bad rap, is you get 9 calories per gram. Oh my gosh! And I'm telling you to eat 100 grams of coconut oil a day, which is crazy. Where are these calories going to go? So MCT oil, if we really break down the science of this, MCT oil only has 6.8 calories per gram. Coconut oil has 8.6, close enough. You round it up, it's 9, a little bit less. But when you consume a high amount of fat and you're not on that, I call it the diabetic roller coaster of consuming too many carbohydrates, you stop craving carbs and your body starts being able to burn fuel way more effectively. And again, we all kind of know this, where you eat a high-fat meal without carbs, you're satiated for such a longer period of time. I'll have anywhere from 30 to 60 grams of fat in the morning for my breakfast, and I'll be good to go until 2 o'clock in the afternoon, and not craving food that whole time either whatsoever. So these fats from coconut oil and MCT oil are just processed in a completely different way, where they're not being stored as fuel, they're being burnt up as energy. So it says medium chain fatty acids, which again are just broken down MCT oil. They're not packaged into lipoproteins for storage, but rather sent to the liver right for energy. So when you have a short chain fatty acid, medium chain triglyceride, that's going to be burnt up as fuel. That's how I think of it, fat as fuel. I wasn't taught that in pharmacy school. I was taught that all this is just going to get stored and it's just going to cause obesity, and it's just strictly not the case. When you get into those long chain, more than 12 carbons, you get to 14, 20, 22, 24, that's where those fats are going to start getting put in as storage, those long chain fatty acids. And so again, we got to realize that just because a fat is saturated, doesn't have any double bonds, doesn't mean that it's going to have a negative impact on our health. Quite the opposite. Yep. There's a side note here, but keeping skin smooth and ageless, there's all kinds of research that talks about how coconut oil, MCT oil, again, it doesn't have those double bonds, and so it helps prevent free radical oxidative damage. So coconut oil is fantastic for skin, hair, so forth. Helps prevent liver spots, which is essentially just oxidative damage to the skin. Helps keep connective tissue strong and supports basically, it's a good anti-wrinkle agent, essentially. So just as kind of side note on coconut oil, MCT oil for skin health.
Is that ingested or?
This you could do topically, actually. Coconut oil you could do. Again, doesn't give you that antibacterial effect, but just for skin integrity in general, it'll definitely help. The one thing I've noticed with patients applying coconut oil for topical use, you need just a tiny, tiny bit to start. I mean, just a tiny bit. Patients always complain that, yeah, it feels really greasy on the skin. That means you've used too much. You're talking just a tiny amount. Like a quarter of a pea size amount, essentially, in an area. I find this fascinating about MCT oil, or MCT. So MCT oil, medium chain triglyceride, breaks that down into medium chain fatty acids. I have a lot of nomenclature up here, I'm sorry. But I'll just say MCT oil, primarily lauric acid, is a critical component for breast milk. So the formula industry knows this, and so they actually put coconut oil or medium chain fatty acids in their formulas because it actually works as lauric acid works as a great antiviral, antibiotic, and so you want that medium chain triglyceride in there. Medium chain triglycerides improve nutrient absorption, help with digestion function, they regulate blood sugar, protect the babies from infection. So that is just critical stuff to have that in there. My note here, though, it's highly recommended to supplement with coconut oil rather than MCT oil. I already made this point, but I'll make it again. MCT oil does not contain the lauric acid, so you need that in there. Well, if you know somebody that's nursing, have them consume a lot of coconut oil. It'll get into the breast milk and make that baby 10 times stronger. And there's studies upon studies that show moms that consume MCT and coconut oil, lauric acid, and how much stronger that baby is. They did a study on piglets of all things, and survival rates were just, I can't remember the exact numbers, but it was over double the amount of a survival rate with this piglet study that I remember, or half remember. Osteoporosis. You wouldn't think of coconut oil as helping with bone function and bone structure, but I wanted to throw this in there. But coconut oil aids in absorption of calcium and magnesium from our diet. And then dietary fats play an important role in bone formation. So saturated fats, again, acts as antioxidants, protects bones from destructive free radicals. So that's something else too. I wouldn't use this as my first choice for osteoporosis, but it certainly doesn't hurt with bone function. Chronic fatigue syndrome. So chronic fatigue syndrome is partially, there's 20 different reasons people have a diagnosis for chronic fatigue syndrome, but one of the primary causes is chronic infection. So again, if you're going to go after chronic fatigue syndrome, make sure you're doing coconut oil over just the plain MCT oil, because you get more of that broader range of antimicrobial effect.
If you're going to take coconut oil by mouth, do you just get plain old coconut oil? Do you have to get something special?
You could do, yeah. I'll talk about that in just a minute.
Oh.
Yeah, yep. That's a great question. Yeah, yep. The brain health. So talking about coconut versus MCT oil. When I'm talking about neurological function, I'm going MCT oil. If I want that quick energy right away, that mental clarity, for sure, hands down, MCT oil. So that's my point on that. Yeah, there's another key point here. So it says, I'll just read this out. Keeping total daily carbohydrate calories under 10% is important, right? You could probably argue that's pretty aggressive, maybe even go 20%. But if you keep your carbohydrate level to a minimum, and you take in coconut oil, you're going to start producing ketones. And one thing that I was, maybe the study wasn't out then, I don't know, but in pharmacy school we were basically taught to that, or even in health class in high school, that your brain can only run on glucose, and that's simply not true. There's studies now, multiple studies, that show if you get your carbohydrate level down low enough that your brain can actually run on ketones, basically short chain fatty acids. And so that's important to know. The one thing here, if you use MCT oil, that will convert into ketones regardless of blood glucose level. So even if you're not eating a ketogenic diet and you want a brain boost, you can do the MCT oil, and that'll give you that instant clarity, essentially.
How do you take the MCT if you're already doing coconut oil? Is there a dosage?
Yep, and I'll get to that too.
Okay.
Yep, we're almost there. So what to look for in purchase. So for coconut oil, I'm just looking for virgin organic coconut oil. MCT oil is essentially just caprylic and capric acid. That's what that breaks down into. The one point on just the couple that we sell here, there's the Now brand and the Biotics Research. Biotics Research, if you look at their labeling, it's just 100% caprylic acid. It doesn't have any of the capric acid in there. If you look at some of the research out there, some patients respond better to a 8 carbon chain versus a 10 carbon chain. You kind of have to try both and see how you feel on each of them to see how you're responding to it. I personally have taken them both. I haven't noticed a difference personally, but that's not saying much. But you could try them both and see how your body responds to them. So here's the dosing question. How much do you take and so forth. So if you're just doing pure coconut oil, I recommend at least 3.5 tablespoons a day, which is about 50 grams. Or you could do 10 ounces of coconut milk, 150 grams of raw coconut, a cup of dried shredded coconut. I really like the Bob's Red Mill shredded coconut. That is talk about flavor compared to just like the stuff in the bag. That shredded coconut is fantastic. Pay a little bit more for it, but in my opinion, taste-wise, it's 10 times better. And then pure MCT oil, you don't need a lot. Tablespoon a day. I personally would start out with a teaspoon a day of MCT oil. You don't need a ton of this to have that, even that small benefit, that cognition, the mental clarity. It doesn't take that much at all.
So So you think really teaspoon? is
One
better?
teaspoon, yeah. Start with that because there's. I think my next slide talks about side effects. If you get too much MCT oil, it can cause insomnia. If you get too much MCT oil, it can cause a GI upset. I will tell you personally, when I take MCT oil, if I just take it just in the morning or midday, it hurts. I can feel it in my liver. It's going right to your liver to be basically broken down from MCT to MC. So MCT from medium chain triglycerides to medium chain fatty acids. So there's a bit of a processing that goes on like in 5 minutes, and you feel it. I definitely feel it. I don't feel that when I take my MCT oil later in the day. Don't ask me why. I haven't figured out that chemistry. I don't get the GI upset. And I'm pointing to my liver, but I'm telling you my stomach hurts. But my stomach does. I don't know why. Yeah. Who knows? Deferred pain, right? But you got to be careful with MCT oil. Start out very slow and be careful with the time of day. If you're going to take MCT oil in the morning, I would combine it with something else. I would combine it with grass-fed butter. I would combine it with coconut oil, some other type of fat, heavy whipping cream, something, and mix it in a smoothie. Have some other protein, have some carbs around it. Your body will be able to better manage that, and then you can kind of build yourself up on MCT oil. So be careful with that. Some of these are kind of drastic side effects. I haven't had any of these consuming all the coconut oil and MCT oil. It's kind of odd that I'm talking about giving you energy and mental clarity, and then one of the side effects is fatigue. But it's kind of like when you're switching, you're switching your metabolism over. It's kind of like, I don't know, let's pick a hybrid car. You know, you're running on a gas engine, and then all of a sudden you're switching over to an electric engine. Your body likes to burn on one fuel, and I'm oversimplifying this, but it kind of likes to burn on one fuel and not switching back and forth. I'm going to burn on carbs, now then I'm going to burn on protein, I'm going to burn on some fat. And so if you're tricking your body, and your liver is going to have to process all this stuff day to day and so forth, it can get a little confused and take more energy and more time to burn through all these different macronutrients that you're throwing at it. So just start low, go slow, and kind of work your way up. For sure. And then, yeah, did I mention, so yeah, MCT oil. So the one thing is it can definitely cause insomnia later in the day too, because you get that, again, within 5-10 minutes, you're getting all that MCT oil into your system instantaneously. It doesn't take anything to metabolize it and break it down, and you could be wired for hours, for sure, on MCT oil. So you got to be careful with that. That I've experienced for sure.
So are these side effects mainly coconut or are mainly MCT or both?
Both. Yeah. Mm-hmm. Yeah.
Because of the dosage you're taking.
Yeah. Typically, it's a dose. Yeah. These are all dose related.
So your system gets used to it.
Yep. Absolutely. Yeah. Do not go and just start. You're going to run to Sendix and start taking 3.5 tablespoons of coconut oil tonight. You might be in trouble. So, I mentioned this. I couldn't remember if it was 74 or 76, but not that it terribly matters. But coconut oil melts at 76. Smoking point is 360. You can do a lot of cooking under 360 for sure. So if it smokes, it's breaking down, and then it's not. The health benefits are basically gone at that point. So you've broken down that fatty acid, where it's no longer useful for the body. I think that was it. I went through that kind of quick. Questions? There's a lot there, yeah.